Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study from the world of equine veterinary medicine, specifically focusing on the often challenging task of recognizing and assessing pain in horses hospitalized for eye-related illnesses. As any horse owner or veterinary professional knows, accurately gauging a horse's discomfort is crucial for developing effective treatment plans and ensuring their overall well-being. Despite this importance, identifying pain in hospitalized horses can be difficult. This is especially true for horses with ocular disease, where the signs of pain might be subtle or masked by other clinical presentations. In recent years, researchers have been exploring more objective and quantifiable methods for identifying pain in horses. This has led to the development of species-specific pain scoring systems designed to move beyond subjective assessments. Two such systems are the Horse Grimace Scale, often referred to as HGS, which evaluates changes in a horse's facial expressions as indicators of pain, and the Behavior Pain Score, known as BPS, which assesses deviations from a horse's normal behavior that might suggest underlying discomfort. While these scales have been used in various medical conditions affecting horses, their specific utility in horses suffering from ocular disease has not been thoroughly investigated. This lack of information highlights the need for research to understand how these pain scoring systems perform in this particular patient population. This brings us to the study we are discussing today, the central aim of which was to evaluate the Horse Grimace Scale and the Behavior Pain Score in horses that were hospitalized due to ocular disease. The researchers hypothesized that the scores obtained from these two systems would be associated with different clinical outcomes or progressions in these horses. Specifically, they wanted to see if changes in pain scores over time could be linked to the clinical decisions made regarding the horse's treatment, such as continuing with medical management, performing ocular surgery, or, in more severe cases, proceeding with enucleation, which is the removal of the eye. Furthermore, the researchers specifically hypothesized that an increase in pain scores would be associated with the decision to enucleate. This study, therefore, seeks to provide valuable insights into the role of pain assessment in managing horses with eye problems. The research team conducted a retrospective observational study. This means they looked back at the medical records of horses that had been hospitalized for primary eye diseases between September 2018 and September 2020. To be included in the study, the horses had to be at least 6 months old and hospitalized for more than 72 hours for a primary ophthalmologic condition. Horses that were admitted specifically for enucleation or had other painful or conflicting health issues, such as temporohyoid osteoarthropathy or laminitis, were excluded from the study to ensure that the pain scores primarily reflected their ocular disease. Over the 2-year study period, the Horse Grimace Scale and the Behavior Pain Score were recorded daily for each horse by one of 5 veterinarians as part of their routine patient assessments. When eye protection masks were being used, they were temporarily removed to allow for accurate scoring, and the horses were given a moment to adjust to any changes in light or sensation before the pain assessments were performed. The scores were then documented in the horse's medical records. As a reminder, the Horse Grimace Scale involves assessing 6 specific facial action units: the position of the ears, the tightness around the eyes, tension above the eye area, the prominence and strain of the chewing muscles, strain around the mouth and prominence of the chin, and strain and flattening of the nostrils. Each of these facial indicators is scored on a scale of 0 to 2, where 0 means the action unit is not present, 1 indicates it is moderately present, and 2 signifies it is obviously present. This results in a total possible HGS score ranging from 0 to 12, with higher scores indicating greater pain. The Behavior Pain Score, on the other hand, evaluates 6 categories of behavior: general pain behaviors, head position, ear position, the horse's location in the stall, spontaneous movement or response to approach, and willingness to lift their feet. Each of these behavioral categories is assigned a score from 1 to 4, leading to a total BPS score ranging from 6 to 24, with higher scores again suggesting higher levels of pain. The researchers then categorized the clinical progression of each horse into one of 3 outcomes: discharge from the hospital after medical treatment alone, undergoing ophthalmic surgery such as keratectomy, conjunctival flap, amniotic membrane transplantation, or corneal transplant, or undergoing enucleation. They analyzed the trends in HGS and BPS scores over time for each horse using a statistical method called linear regression. This allowed them to estimate the initial pain scores at admission and the rate at which these scores changed during the horse's hospitalization. Finally, they compared these initial scores and the rates of change among the 3 groups of horses based on their clinical progression to see if there were any significant associations. The results of this study provide valuable insights into the use of pain scoring systems in horses with ocular disease. A total of 65 horses met the criteria for inclusion in the study. Of these, 29 horses, or 45%, were discharged after receiving only medical treatment. Another 28 horses, accounting for 43%, underwent some form of ophthalmic surgery, and 8 horses, or 12%, ultimately underwent enucleation. Interestingly, a small number of horses, just 3%, required 2 separate ophthalmic surgical procedures. The types of surgical procedures performed were varied and included corneal grafts, conjunctival grafts, different types of keratectomies, tumor resections, corneal transplants, and other specialized treatments. The researchers found some significant differences in the pain scores between the groups of horses. Notably, the behavior pain scores at the time of admission to the hospital were actually higher in the horses that were successfully managed with medical treatment alone compared to those that eventually required enucleation. This suggests that horses presenting with seemingly higher levels of behavioral pain on admission might be more responsive to medical intervention. However, when looking at how the pain scores changed over the course of hospitalization, a different picture emerged. The study found that horses requiring enucleation showed significantly greater increases in both their Horse Grimace Scale scores and their behavior pain scores during their hospitalization compared to the horses that were managed medically. Furthermore, the increase in behavior pain scores was also significantly higher in the enucleation group compared to the horses that underwent ophthalmic surgery. These findings strongly suggest that a worsening trend in pain scores, as measured by both facial expressions and behavior, may be an important indicator that medical management is failing to adequately control discomfort and that more drastic measures like enucleation might become necessary. Interestingly, the study did not find any significant differences in the initial Horse Grimace Scale scores at admission or in the rate of change of either the Horse Grimace Scale or the behavior pain score between the horses that were managed medically and those that underwent ophthalmic surgery. This could imply that the initial level and subsequent changes in pain, as measured by these scales, might not be the primary deciding factors in choosing between medical management and surgical intervention for globe-sparing procedures. The decision to pursue surgery in these cases likely involves other considerations, such as the specific type and severity of the ocular lesion, the potential for vision preservation, and perhaps even financial constraints. In fact, a notable portion of the horses in this study, 17 out of 65, underwent surgery within the first 48 hours of admission, indicating that in many instances, surgical intervention was planned or deemed necessary very early in the course of treatment, potentially even before a full assessment of response to medical management could be made based solely on pain scores. The researchers also looked at the prevalence of complications during hospitalization. They observed that a small percentage of horses developed right dorsal colitis, a known complication associated with the use of nonsteroidal anti-inflammatory drugs, or NSAIDs, which are commonly used for pain management in horses. A few horses also showed evidence of acute kidney injury, another potential side effect of NSAID administration. Additionally, a small number of horses experienced episodes of colic, which in some cases might be linked to general anesthesia for surgery or changes in gastrointestinal motility. Notably, in one horse that developed colic after surgery, an increase in both Horse Grimace Scale and behavior pain scores was observed in the days leading up to the colic episode. This observation highlights the potential for pain scoring to not only reflect ocular discomfort, but potentially also other emerging issues. The discussion of these findings emphasizes the potential value of incorporating pain scoring systems like the Horse Grimace Scale and the behavior pain score into the routine monitoring of hospitalized horses with ocular disease. The study's conclusion that increasing pain scores over time were associated with the need for enucleation underscores the importance of continuous pain assessment in these patients. This suggests that if a horse's pain, as indicated by these scales, is not improving or is getting worse despite treatment, it might signal a poorer prognosis for medical management alone and could help clinicians make more informed decisions about when more aggressive interventions, such as enucleation, might be necessary to alleviate suffering. Interestingly, the finding that horses managed medically had higher behavior pain scores at admission compared to those undergoing enucleation highlights the complexity of using a single time point assessment to guide treatment decisions. It suggests that while a high initial pain score might prompt more intensive medical therapy, the trend of pain scores over time appears to be a more critical factor in predicting clinical progression, particularly the need for enucleation. The researchers speculate that horses with high initial pain from acute conditions might respond well to medical treatment, whereas those with chronic, recalcitrant conditions might present with more moderate initial pain but ultimately have a less favorable outcome. The study acknowledges several limitations. The sample size, particularly for horses with specific ocular conditions like uveitis, neoplasia, or trauma, was relatively small, which limited the ability to draw definitive conclusions for these individual disease categories. Furthermore, pain scores were not consistently recorded for all days of hospitalization, which could have affected the assessment of pain trends. Additionally, the fact that multiple veterinarians were involved in assigning pain scores introduces a potential for variability, although previous research has shown good agreement among observers for the Horse Grimace Scale. Finally, the variability in the initial diagnoses and treatments administered also adds a layer of complexity to the interpretation of the results. Despite these limitations, this study contributes valuable information to our understanding of pain assessment in equine ophthalmology. It provides evidence that the Horse Grimace Scale and the Behavior Pain Score can be useful tools for monitoring the progression of ocular disease and the response to treatment in hospitalized horses. The finding that increasing pain scores are associated with a need for enucleation has direct clinical relevance, suggesting that these pain scales could aid veterinarians in making timely and informed decisions regarding the most appropriate course of action for their patients. The researchers emphasized the need for further research to better understand how different types of ocular disease contribute to pain scores and influence clinical decision-making in horses. This will undoubtedly lead to even more refined and effective pain management strategies for our equine companions in the future. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.